The medical assistant may prepare a specimen in the medical office for a hematologic laboratory test known as a white blood cell differential count. There are 5 types of white blood cells or leukocytes. These include neutrophils, eosinophils, basophils, monocytes, and lymphocytes. The purpose of the differential count is to identify and count the 5 types of white blood cells. An increase or decrease in one or more types may occur in pathologic conditions, which assists the physician in making a diagnosis. The normal adult range for neutrophils is 50% to 70%. The adult range for eosinophils is 1% to 4%. The adult range for basophils is 0 to 1%. The adult range for monocytes is 3% to 8%. And the adult range for lymphocytes is 20% to 35%. The differential count can be performed automatically or manually. If it is performed manually, the outside laboratory will want you to prepare 2 blood smears. The laboratory needs 2 blood smears as a means of quality control. A differential count is performed in conjunction with a complete blood count, more commonly known by its abbreviation of CBC. The medical assistant will show you how to draw a blood specimen for a CBC and how to prepare 2 blood smears for a manual differential count. Before proceeding, sanitize your hands. Greet the patient and introduce yourself. Identify the patient by full name and date of birth and explain the procedure. Assemble your equipment. You will need the supplies required to perform a venipuncture, 2 slides with a frosted edge, and a slide container. Use a pencil to label the 2 slides on the frosted edge with the patient's name and the date. Cleanse the puncture site with an antiseptic wipe and allow it to air dry. Apply the tourniquet on the patient's arm. Apply gloves. Perform a venipuncture. The best type of specimen to use for a manual differential count is fresh whole blood. Fresh whole blood remains in the needle immediately following the venipuncture. After withdrawing the needle from the patient's arm, deposit 1 drop of blood onto each slide. Your lavender tube can be used to help push the blood out of the needle. Place the drop of blood approximately 1/4 of an inch from the frosted edge of the slide. Now you are ready to prepare the blood smear. Hold a spreader slide in front of the drop of blood and at a 30-degree angle to the first slide. The angle is important. If it's more than 30 degrees, the smear will be too thick, causing the cells to overlap. Cells that overlap do not stain well and are smaller than normal, which makes them more difficult to identify. If the angle is less than 30 degrees, the smear will be too thin. This causes the cells to spread out, and it takes more time to count them. Move the spreader slide until it touches the drop of blood. The blood distributes itself along the edge of the spreader by capillary action. Using a smooth, continuous motion, spread the blood thinly and evenly across the surface of the first slide, ending the motion by lifting the spreader slide off the specimen in a smooth, low arc. The blood smear is thickest at the beginning and gradually thins to a very fine feathered edge. Prepare the second blood smear in the manner just described. If the blood smear has been prepared correctly, it should be smooth and even with no ridges, holes, lines, streaks, or clumps. It should not be too thick or too thin. There should be a feathered edge at the thin end of the smear. Dispose of the spreader slide in a biohazard sharps container. Lay the blood smears on a flat surface and allow them to dry to prevent shrinkage of blood cells, which makes them difficult to read. Never blow on the slides to dry them. You might exhale water droplets that could make holes in the smears. Place the slides in a protective slide container. Prepare the blood tube and slides for transport to the laboratory. Place the lavender blood tube and slide container in a biohazard specimen bag and seal the bag. Remove your gloves and sanitize your hands. Complete a laboratory request form. Place a copy of the laboratory request in the outside pocket of the specimen bag. Chart the procedure. Include the date and time, the type of collection, and the date the specimen was transported to the laboratory. File a copy of the laboratory request in the patient's chart. Place the specimen bag in the appropriate location for pickup by laboratory courier.